Hi, this is DrRic with a tutorial on a multivitamin, on choosing a multivitamin. If you're on the standard American diet, then you should be on a multivitamin. Again, as I had mentioned in previous lectures and tutorials, unless you have a purely organic Hi, this is DrRic for a tutorial on picking a multivitamin. My average patient really should be on three things. That's a multivitamin, vitamin D, and then an omega-3 fish oil. And with regards to multivitamins, let's start with young folks or teenagers or adolescents. When I have somebody that comes in with a parent and the parent asks me about starting something, I always say yes. It's important to be on a daily supplement. The one caveat is that with high schoolers and college students or athletes, they usually will get turned off by taking so many pills. Some young people don't even like swallowing pills. So it's more, again, with sustainability, it's more important to develop a habit. So my average young person will probably do okay without a multivitamin, at least if they're not obese, if they're exercising, or if they're eating properly. But to me, what's more important is the habit of taking it once a day. So in the case of a young person or a beginner, like some of my guys at 40 years of age that come in, haven't seen a doctor for a physical in decades, but yet want to get healthy, I don't want to overburden them with a whole bunch of pills, so a once-a-day single caplet or tablet is fine. Once you do that for about a year's time, then we talk about the multi-packs. So altogether, single tablet multivitamins are probably alright. That would be like a Centrum Silver or a Costco brand or Sam's Club brand, one a day. Sometimes there's one-a-days, one-a-day silvers, Centrum Silvers, one-a-day teen. I wouldn't take them personally. I like the multi-packs because of in choosing minerals and vitamins, you have to take into consideration binding the vitamin or a specific mineral altogether. And I just don't believe that you can put the majority of your requirements in one capsule or tablet. So usually if you have a big pack like this, has several different things all together, you wonder, well, why am I taking all these things? It's because usually the binders that hold some of these things together won't work with the binders that hold other things together. Some of the vitamins are fat soluble and have to be in a capsule with oil. Others are water soluble and have to be in a tablet. So that's how I suggest my gifted athlete or my patient that's looking for the next level take their multivitamins. And it's up to you as far as researching. I would not spend that much money, but I wouldn't go super cheap. I like going to Whole Foods. I also like Fruitful Yield. This is a $10 a month pack at Whole Foods. It has some basic good components in it. This, again, going back to, so that's what I would suggest, that's what I take, and that's what I would suggest for the patient that's trying to look for the next best thing compared to a single capsule or single tablet multivite. So the bottom line is, if you're starting out or if you're on a fixed budget, go with single capsule or single tablet multivitamins. They're better than nothing. Don't go too cheap. You get what you pay for. There was a study back in the, I think it was the 70s, no, it was more the 80s or 90s, that evaluated over-the-counter supplement companies, and they found that about three-quarters of the companies, three-quarters of the tablets that they studied did not have the ingredients that were on the label. And the FDA is not watchdogging supplement companies, so the rule of thumb is that the supplement company is responsible for checking and maintaining high-quality ingredients. So if you have a supplement company that's good, great. If you have a supplement company that's kind of shady or fly-by-night, you're probably going to be having nothing but binders or poor quality vitamins. So you get what you pay for. And I understand if you're on a budget, then you have to do what you have to do. when the time is ready, or when disease comes up, you have to put the money into nutrition and supplementation. And that's when you have to bite the bullet and go a little more expensive. Also with teens, with young people, if they're hesitant, stick to a 1 day. With older folks who are just starting up, stick to a 1 a day. It's easier that way. For the most part, if you take it with food, it's probably the easiest thing, so you don't have too much of a problem with an upset stomach. Now, that's also a deal breaker. If you have a person that's just starting and you give them multiple things to swallow, or you give them something that really causes irritation to the stomach, they're not going to maintain it. It's not sustainable. So for my patients who are looking for a better option, higher reliability, go for the multi-pack. And you might have to research your companies. There's always an 800 number on the back of the company's box or bottle. I would always call up the 800 number and query, ask them a couple basic questions. My old rule of thumb was if there was an 800 number, that was a good company. I didn't have to call them, just the fact that they put an 800 number there. Second rule of thumb, if there's somebody on the other line, not just a recording, that's also a good sign of a company that's invested. And then if there's a research and development department that they'll forward you to, that's even better. The final is that if there's somebody on the other line that calls back and discusses things with you. I had the pleasure of talking to a representative from Now Foods. It's a company based in Illinois. I sent a phone call out. There's something called 5-HTP that I use for my patients who have seasonal affective disorder, depression, or anxiety, or difficulty with sleep at night. And 5-HTP, I'm not going to get into it now, I'll talk about that later, but you have to worry about peak X because of problems with tryptophan in the 80s. So I called, I left a message, and I didn't think I'd get a call back, but I actually got a call back, a nice discussion, and they actually said that they check for peak X, peak Y, and other things, and that's actually a good callback. So that is a company that's invested in putting out good quality. So if you have any further questions, contact me via my website, or seek out a nutritionist, a registered dietitian, or a naturopath. They can always help you. Docs, MDs, and DOs sometimes don't have a good basis in nutrition. I think the average medical school probably gives about a month, 2 to 4 weeks of nutrition teaching or counseling for their doctors going out there. So unfortunately, we have other things we have to be learning, but nutrition is a little bit lacking in most medical schools. So that's when I forward my questions, or in general, if there's other questions, you ask somebody who's been trained by either the American Academy of Sports Medicine, ACSM, or have done nutritional fellowships, or have gone the route of 4 years of study like a registered dietitian. So hopefully this helps. This is Dr. Rick with a tutorial on multivitamins.